Welcome to part 3 of our educational series in the ED Innovation Study. Here we will be going over our experimental protocol. It will discuss who is eligible to be in the study, what each patient needs before discharge, and the treatment algorithm we will be using. This is really the meat of the study, and with that said, let's see what's on the plate. So doctor, what is the aim of the study? Well, suppose we had a patient with opiate use disorder who will be discharged from the ER to be seen by a behavioral provider within 7 days. We want to see if this new medication, CAM 2038, is better, just as good, or worse than traditional sublingual Suboxone prescription in getting these patients to their appointments. So upon discharge with such a patient, and if the patient is eligible for the study, he or she will be randomized to receive either sublingual Suboxone plus a prescription or the CAM 2038 extended release injection. Our research assistant, or RA, will follow up with these patients at 7 and 30 days to make sure that they are in formal outpatient addiction treatment. We will need a minimum of 5 of these patients enrolled in the study each month. Who is the perfect patient for this study? Patients included in the study have to be 18 years or older, in the ER during active hours of the study, meet the DSM-5 criteria for the diagnosis of moderate or severe opiate use disorder, have a COWS score of 8 or more, which is a score for opiate withdrawal, a positive urine drug screen for opiates, and be able to understand and speak English. So in order to have an eligible patient, you must have a DSM-5 form for opiate use disorder, a COWS score form, and a drug screen. Patients who cannot be part of the study are patients who have a positive urine drug screen for methadone, pregnant patients, any patients needing to be hospitalized for any reason, suicidal patients, severely cognitively impaired patients, patients already in a SNF or extended care facility, any patient on prescription opioids specifically for pain, patients unable to provide reliable contact information including 2 phone numbers other than their own, patients unwilling to follow study procedures, prior enrollment to the study, or patients who are already in formal addiction treatment within the past 14 days. However, patients enrolled in an addiction treatment and not receiving any medication-assisted therapy like Suboxone or methadone can be enrolled in the study. Okay, let's put all of the above in action. Here's the study flow, the process in which the patients will be enrolled and randomized in the study. As we briefly talked about, the eligible patients need to have diagnostic criteria for either moderate or severe opiate use disorder. We will be using the criteria listed in the DSM-5. This checklist should not be memorized. We will have laminated cards in the ER for your reference. Check all that apply to the patient. In order to have moderate opiate use disorder by criteria, you will need 4 or 5 of the listed checked, and to have severe opiate use disorder, you will need 6 or more. Next, you will need a COWS score. This is a rating scale to measure the level of opiate withdrawal. Remember, the patient must be in withdrawal to receive buprenorphine to avoid precipitated withdrawal from taking it. This score includes signs and symptoms such as pulse, yawning, sweating, GI upset, and more. This is the COWS score. Again, do not memorize this chart. We will have laminated scorecards in the ER. You will need a COWS score of 8 or above to be in the study. If this patient meets DSM-5 criteria, has a COWS score of 8 or above, an opiate-positive drug screen, and fulfills the inclusion and exclusion criteria for the study, this patient is perfect for this study. Our research assistant will have them sign for informed consent and start the randomization process to get either sublingual Suboxone or the CAM 2038 injection. Suppose the patient is randomized to sublingual buprenorphine. Let's look at the sublingual Suboxone arm of the study flow. Their initial dose is dependent on the level of withdrawal based on the COWS score. If the patient has a COWS score of 8 to 12, this patient gets an initial dose of 4 milligrams. After 30 to 45 minutes, if the patient has no ill effects, give another 4 milligrams sublingual for the total of 8 milligrams. Then, after 30 to 45 minutes, if the patient has no other ill effects, the patient can be discharged home with a 7-day prescription for Suboxone. Now, if the patient is in moderate to severe withdrawal with a COW score of over 13, the patient should get 8 milligrams of Suboxone. He or she should be watched for 60 minutes, and if there are no ill effects, can be discharged home with, again, a 7 days prescription for Suboxone. It is important to note that an extra 4 milligrams of rescue Suboxone can be given if the patient is still in significant withdrawal after the observation period, for a total maximum dose in the ER of 12 milligrams. Now let's look at the extended release buprenorphine arm of the study flow. This is the drug in question called CAM 2038. This arm requires at least 2 separate COW score separated by 2 hours of observation. The patient will receive the injection of the CAM 2038. For a detailed guide on how to give the medication, please watch part 4 of the study videos called CAM 2038 administration. After the injection, wait for 2 hours in observation, and the patient will need a second COW score. If the patient still has a COW score of over 12, a rescue dose of 4 milligrams of sublingual Suboxone should be given. Otherwise, the patient can be discharged home. But sir, the patient still has pesky withdrawal symptoms despite the buprenorphine. Now is the perfect time to sign out the patient to Dr. Best. If the patient still has withdrawal symptoms within a COW score over 12 in either arm, certain supportive medications can be ordered or prescribed for pain, nausea, stomach cramps, as shown here. So now you know the protocol. Remember, if you have any questions regarding the process of the study, please find our research assistant, Nicole Cothey, our primary investigator, Dr. Williamson, or me, Dr. Lee, and we can help. Thank you for everything you do and helping our ER strive for better patient care.